going to be your student nurse for the day. My name is Karolina. I wash my hands before entering. Could you state your name and date of birth for me?
McKenna Pearson, 11/24/1999.
Okay, and do you have any allergies at all?
No.
So none to environmental, medications, or food?
Nope, not that I know of.
Okay, perfect. And then I would go ahead and assess the patient's orientation. So can you tell me where we are right now?
We're in our apartment.
And why are we here?
We're doing a video check off.
Yep, and what's today's date?
October 28th.
Okay, perfect. So then I'm gonna go ahead and assess your heart rate and respiratory rate.
Okay.
I'm first going to locate her radial pulse and assess if it is regular or irregular. And it seems to be regular at a pulse grade of 2, which is normal. And because it's regular, I'm going to go ahead and grab my stopwatch and count for 30 seconds. Okay, and I counted about 42, which brings us to 84 beats per minute, which is regular. And then I would assess her respiratory rate by watching her chest rise and fall for another 30 seconds. And I normally would not tell this to the patient so that it does not affect the reading. So I would pretend as if I was still taking her pulse. Okay, and I counted 6, so that brings us to 12 breaths per minute, which is normal. And then I'm going to go ahead and assess her neuro with the different cranial nerves. So we're going to start with cranial nerve 7 for facial symmetry, looking for any droops or swelling, discoloration, and everything seems to be normal. Then following that by assessing the facial muscles, I'm going to ask you to smile and show your teeth, and then raise your eyebrows up, looking for forehead wrinkles. Okay, perfect. And then assessing cranial nerve 5, which is motor and sensory, I'm going to just feel her masseter muscle and ask you to clench. Okay, perfect. Both are equally strong. And then assess the sensory with a sharp and dull end on the 6 positions on the face. And you're going to do this bilaterally as well. One with the dull end. Okay, did you feel any tenderness at all?
No.
Okay, perfect. And then I'm going to move on to cranial nerves 9 and 10, and ask you to stick your tongue out and say ah for me.
Ah.
Okay, the uvula is rising with phonation, and the tonsils seem to be a 2, which is normal also. Then I'm going to go ahead, go back to cranial nerve 7 and inspect the tongue protrusion. So ask the patient to protrude your tongue out and move it side to side for me. Okay, perfect. I don't see any swelling or fissures or thrush. And then I'm going to go ahead and inspect the eyes. Look at the lids, the conjunctiva, the sclera, and the cornea. I don't see any swelling or redness or drainage. So then I will test the extraocular eye movements, which is cranial nerves 3, 4, and 6, at the 6 cardinal positions of gaze. So I'll just ask you to follow my pen light, just moving your eyes. Okay, perfect. So the patient's eye muscles seem to be working properly. The eyes are moving smoothly, and they're also moving parallelly together. So then I am going to test the corneal light reflex with the pen light. I'm going to shine it, and I'm going to ask you to just look behind me. Okay, perfect. So I don't see any exotropia or esotropia. I saw the speck perfectly. And then I'm going to test the pupillary light reflex. So I'm going to ask you to look at the light this time. Okay, perfect. So the pupils dilate or constrict to the light directly and consensually. And then for cranial nerve 3, I'm going to test for accommodation. I'm just going to ask you to follow the pen light with your eyes. Okay, perfect. So the eyes adjust to the distance properly as well. And then for visual acuity for cranial nerve 2, I would either use a Snellen chart from 20 feet away or a Rosenbaum chart that's smaller from 14 inches away, and ask the patient to read me the smallest line that they could see for visual acuity. And then I would go ahead and test hearing for cranial nerve 8, and I'm going to have you stand up and face away from me. And then just cover your right ear and repeat back to me what you hear. 1, 2, 3.
1, 2, 3.
And then cover your left ear. 4, 5, 6.
4, 5, 6.
And then test one more time. 7, 8, 9.
7, 8, 9.
Okay, perfect. Now have you turn back around. And now I'm going to palpate for your shoulder strength. And this is cranial nerve 11. And I'm going to apply resistance to your shoulders, and you're just going to shrug against that. Okay, good. So they're rising together with good strength. So then I'm going to do the bilateral hand grasp. So if you could pull out your hands like that, and I'm going to pull against mine. Yep, good. They're both equally strong as well. And then I'm going to have you sit back down, and we're going to test the lower extremity strength. So I'm going to apply resistance to your shins, and if you could just push against that. Okay, good. Yeah, so everything seems to be good. She has bilateral strength in all of her extremities. Do you have any questions or concerns for me at all?
Nope, all good.
Okay, great. Thank you for coming in today.
Thank you.